And as we had mentioned, almost no part of the U.S. is being spared right now from COVID. Keri Althoff is an associate professor of epidemiology at the Bloomberg Hopkins School of Public Health, and she's joining me now from Baltimore to help make sense of what we're seeing around the country. Keri, it's great to have you this morning. Health and Human Services Secretary Alex Azar, he was just interviewed on Fox Business, and he urged Americans to, quote, exercise extra caution during Thanksgiving and Christmas gatherings. Now, he also said that schools, workplaces, airlines, those aren't actually vectors for spreading the coronavirus. So what do you make of the Secretary's comments? On the one hand, don't do the holiday gatherings, but on the other hand, it's okay to be going to school, work, and traveling on airplanes.
So I think the biggest concern that we have coming up is, first of all, as you noted, cases are increasing in most states in the United States currently. And we are all starting to prepare for a holiday that typically the events are held on a single day, right? And we have a lot of information now that there are household and small gatherings that are really propelling a lot of transmission that's going on in the country right now. Now, I would say that most schools that are open, they do have, many have precautions in place, but they are subject to what's going on in the community. The more community transmission, the higher risk for anybody to be at the grocery store or at a school. Travel itself is still considered a riskier undertaking, and you have to really think through the benefits and the risk that go with traveling right now.
Keri, one thing that's been absolutely fascinating about this pandemic, and I think it's fair to say fascinating, even though it's just been devastating to so many people, is watching the science play out in front of us in real time. I mean, I think back to March when the Surgeon General was on TV telling people not to wear masks and that the only people who should wear masks are those folks who work in hospitals and on the front lines. But since then, of course, the research and the research has certainly changed. What are the CDC's latest guidelines about mask wearing?
So the CDC summarized some additional scientific evidence that has come out during this pandemic, and they summarized it this week, and it just is more evidence that, science is doing what it does. We are actively researching, we are actively trying to understand the best, most effective ways to mitigate transmission and community spread of this virus. So what the CDC found is that masks not only protect others in your community, but there's a personal benefit to wearing a mask as well, which is a critical piece of information. And the CDC notes, and I quote, individual prevention benefit increases with increasing numbers of people using masks consistently and correctly. End quote. The translation of that is masks work best when everyone is wearing them. And so this CDC review was a really nice piece of work to put forth. Here is where we're at with the scientific evidence. And interestingly, they did include this preprint, which means it has not yet been peer reviewed, but it was an economic analysis of the US, and it found that increasing universal masking, right, everybody wearing a mask, by just 15% could prevent the need for lockdowns and reduce associated losses up to 1 trillion, or about 5% of GDP. So the virus does not know your political leanings, but it does know if you're not wearing a mask. And so I think that the message here from the CDC is very strong and clear right now. Masks work, they protect your community, they protect yourself and your family, and they do their job the best when everyone is wearing a mask.
I think that's a really great way to put it, and also to put that dollar figure on it and the figure about how it affects the economy, because if nothing, if you wear a mask for your own health, wear a mask for other people's health, and wear a mask to avoid lockdowns and help the economy. President Trump is receiving a closed-door briefing today on Operation Warp Speed. That's the program to get a vaccine off the ground. He's been silent, though, on the virus over the past week, as he's certainly reporting a show that he has been stewing about the election. What more do you want to see from the federal government at this time when it comes to the response?
So I think one thing we really need to make sure that we have solidly in our toolbox of things that we can do to help fight this pandemic is testing. We really need to make sure that everybody has access to testing. And there are still parts of the country where it's not great access to testing. So testing first and foremost, but then we need to start doing more about different kinds of testing, right? So there's testing when somebody believes they're sick, they may be symptomatic. There's testing when people are exposed, but they're not symptomatic. There's testing that we could be using when kids come into schools or when people are getting onto airplanes or other things where we're just trying to screen for individuals who may not be feeling ill, but may be infectious. So those are the types of the whole kind of toolkit of testing alone is a place where we really need both federal guidance, but also just resources so that the states all can have access to a whole array of testing.
And Keri Althoff is Associate Professor of Epidemiology at the Bloomberg Johns Hopkins School of Public Health. Thanks so much for your time. We appreciate it.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quicktake now for insight in an instant.